I'm going to be demonstrating suctioning of a tracheostomy. So right off the bat, I have my suction catheter kit and then some sterile saline. Lots of good privacy. Hello. My name is Marilyn. I'm going to be your nurse today. Looks like there's an order to do some trach suctioning. Is that okay? Okay. Can I confirm 2 patient identifiers, full name, date of birth? Okay. So I will explain to you the procedure as I go. I would grab some sandy wipes, clean off my table, set down the supplies. Okay. So, first things first, I just want to do a quick assessment to see how we're doing. I put the O2 stat monitor on, giving a listen, some deep breaths. Yep. Sounds like there's some secretions in there. That O2 stat is under 90. 89, I feel like we can get that up. Put this here. So, before starting, I'm gonna hyperoxygenate you using 100% oxygen for a few minutes. Yep. So oxygen. It's been a few minutes. I'm gonna ensure that I have the suctioning here readily available. I'm going to raise the head of the bed to safe working height. And then just position you a little bit better. Make sure I'm leaning back. There you go. Okay, so you've been oxygenated. The suction is ready. I've assessed you. So next I am going to clean my hands and then using sterile technique open up my kit. I've cleaned my hands. I'm going to have a little container here and then pour some solution or normal saline in here. Making sure not to touch and contaminate. Setting this aside. Making sure it's good. Okay. And then I'm going to remove this out of the way. Making sure that you're still kind of getting oxygenated from afar. Okay. Looks pretty set up. Okay. Clean my hands again. I'm going to put this over here. So now I'm going to don sterile gloves. They were not packaged back the best, but so I would do a pinch method. Put my right glove on and then pretend that this one was over here. And then I would do the scoop method. Scoop. So pinch and scoop. Make sure this cooperates. This is now my sterile field. Now grabbing this catheter. If I remember correctly, so my right hand is going to stay sterile and then my left hand won't. Okay. So my left hand, I will be connecting this catheter. And again, this one isn't going to be sterile because it's how I'm going to control the suctioning. So I'm going to test to make sure that it's working. Yep, okay, it's clearly working. Alright, so I'm going to now suction your trachea during inspiration. So I'm gonna advance without any suctioning, making sure not to touch. Okay, there's resistance, gonna pull back 1 centimeter. Apply suction, making sure I don't take more than 10 seconds in a rotating manner. Okay, all right, sectioned. Now I'm going to rinse in that normal saline. And then so I'm going to be doing 2 passes, but before I do that, I'm reassessing the oxygen. Looks like we could use 1 more. Then I would wait 1 minute of rest period, and during that rest period, again, let them oxygenate for a few minutes, or a minute. Yeah, and so time has passed, they've been re-oxygenated. I cleaned with normal saline again. We're gonna repeat the process. So again, doing inspiration, no suction, advancing, resistance, pull back 1 centimeter, rotating, while applying suction, no more than 10 seconds. Okay, so the trachea has been sucked. So now I'm gonna curl this up. Curl it up, curl it up, curl it up. And then I would throw this away, but I'm reusing it for practicing purposes. So I can take this off, or turn the suctioning off. My gloves, throw away all my supplies, hand hygiene. Gonna make sure to give you your oxygen back, but also very important, going to reassess. Alright, that is it for the sectioning. Gonna give another listen to your lungs. Oh yeah, sounds a lot more clear. Oh wow, your O2 stats went up. You're at 93 now, that's awesome. Okay, looks like that was an effective intervention. Okay, and then your oxygen is on, it's good. Gonna reposition you, lower your bed. Make sure you have your collar, 4 P's, any pain, potty, positioning. Alright, looks good. Very important, I'm going to document. So I'm going to document the secretions, the patient's tolerance, the O2 stat, the respiratory assessments before and after, and skill complete.